thank you for coming here. I would like to thank the Foundation and also WOC for the opportunity of being here, and also my colleague, Paco, from the WOC. I will present you the study we have been developing in Lisbon for the last 2.5 years. We have done it in parallel with the study that has been developed here by a team in WOC. And the project is Health in the Information Age, and I will show you some of the results and some of the questions that raise from it. What we're trying to answer was why health and information? And also, what does the internet say to us? I will show you from a research in YouTube, 9 seconds of Dr. Haas. Sound, please. Can we have sound?
There's a lot of porn piling up on the internet. Doesn't download itself. Find the toxins, you run your bubble study. You won't find anything, and I'll get the office to myself. There's a lot of porn piling up on the internet. Doesn't download itself.
Does it sound familiar? Does it sound like the notion that internet doesn't really help us with nothing really important? Let's see now a few minutes of Google.
My husband, Christian, has Crohn's disease, which is an inflammation of the bowels.
I had a very mild heart attack here in New York City.
The biggest thing about my medical conditions is my history of breast cancer.
At first, I had never heard of Crohn's disease, so I was very concerned, and that's when I decided I should do a little research.
I wanted to know everything that was going on with me suddenly.
Anytime you're educating yourself on any given subject, and especially when it's about your health, it can only be a good thing.
With this type of disease, you always want to find out what's new, the new medicines, the new treatment options. So the internet has been really useful to find out the new medicines that are out there, the new treatment options, the new surgeries, any new discoveries about Crohn's.
My name is Dr. Donna Bell. I'm located in Manhattan, New York City, and I've been practicing for 24 years.
My name is Dr. Kevin Baumlin, and I live in New York City. I've been an emergency physician for the last 12 years here in Mount Sinai Hospital.
I'm Eric Capula. I practice in Manhattan, New York, in the Upper West Side. I've been practicing approximately for about 13 years.
The biggest pressure I'm facing in terms of managing patients is monetary.
We're overpressed and overcrowded. We have too many patients, but they don't get enough health care.
For research in my medical practice, I use several professional sources, but primarily for convenience, the internet.
I research hypertension, or I research new guidelines that might come up.
We use the internet to check prescription drug information for interactions, as well as to check pills that are unidentified.
When Christian was having surgery this past year, I found myself on the internet 24/7.
I spend hours researching.
I did a lot of research at night when I was alone, when I had the patience, the time to read it. I printed out a lot of...
So, I don't have time enough to show you everything, but anyway. Do these people in this audience have the same testimonials, but not in English? The answer may also lie in the media, but I think it's not enough. Why? Because we have to look at people, doctors, nurses, pharmacists, patients. We also have to look necessarily at institutions, hospitals, public and private, medical centers, primary care institutions, pharmacies. But also we have to look at content, at internet pages, at blogs, at search engines. It's of all the things that this study is about, and the study is called Health in the Information Age. It was developed in Portugal with this parallel, but the data I'm showing here is just the data that we achieved in Portugal. The goal of the study was to analyze in what way information and communication technologies are appropriated in the health field by users and also by professionals in the context of the network society in Portugal. To question, how can internet be used in communication and to provide health information? What tell us the experiences of consumption and information technologies used by health professionals? Which is the value and the impact of internet in the public health campaigns? And which other communication technologies are valued and used? For that, we have now, the study is finished, and we have a few reports, 4 different reports. And the first one I'm going to present you is the one about health professionals. We questioned 1,000 doctors by postal survey, 1,000 nurses by postal survey, and also 160 pharmacists by online survey. And we can say now that internet is used by 77% of doctors and 63% of nurses. And 92% of doctors and 80% of nurses use internet in their professional practice. If we just look at doctors and physicians, we know that 52% do use internet in diagnosis evaluation, 46% in prescriptions of therapeutic measures, 32% in prognostics evaluations, 90% in therapeutic execution of therapeutic measures, and 36% recommend internet websites to patients. The online consulting of information may lead to questioning the doctor's knowledge. This is something that physicians, 24% of them think very much, and 49% quite. When asked if they agree with a single patient record accessible by the doctor through the internet, 53% totally agree. And when we ask them if they agree with any remuneration to the interaction with clinical purposes, 45% agree with that using the email, and 39% the telephone. Nurses, 55% of them think that internet is very useful for professional practice, and 40% think it's useful. 80% of opinions think that internet information improves autonomy and quality of life for the patient. And 54% agree with a single patient record accessible by the professional through the internet. The pharmacists, 81% want to think that will be nice, quite a good possibility to have reception of prescriptions by email, if they could. Now they could, but they wouldn't be able to do that when the data was received. And 71% think that it would be a nice thing to reception the user's direct requests. They will use, if they can, the practice of sending SMS to remind patients to take the medicines. And 19% of them think that the contents in the internet are very relevant in English, and 61% in Portuguese. The other report was about patients and health, and in this case, we questioned 2,000 users by presential survey with a representative sample of the population. And one of the questions was about the perceptions and use of the national health system. And we found out that when people have a non-urgent health problem, they still prefer the doctor of the national health system, but then they go to the pharmacist, not to the internet. And with an urgent health problem, they will go, in the majority, to a public hospital, to the emergency service, then to a health center emergency service, to a doctor, and only very few will go to a private institution. We also know, and this is data from our National Institute of Statistics, that the search in the internet about health is being growing since 2004 until 2007. As you can see, the growth is very big. We ask also the population if they would like to use online medical service, and only 9% of them said that it would be a nice thing to do. On the other hand, we have the helplines, the telephone support, but 95%, almost 96% of the people never used. And when they use for pediatric questions. 96% say that the doctor never dissuaded them from looking for information online. But when they do, the reason they point is the risk of self-diagnosis or the lack of knowledge from the patient. 8% of those that got their doctor's cell phone number phoned them and got the answer. 60% used it, and 6% were contacted after leaving a message. I will show now some of the conclusions we achieved with these two reports. The first one is that mediation arrived to the health field. It's part of professionals and users' routines, but is not part of public health policies, health field science teaching integration, protocols of professionals' practice in the relation between user and health professional. What has changed? The supremacy of network morphology over action, and what is still to be changed? The structural practices of the actors involved. But now we have Google Health, that is not already online. This is a beta version, but it will be very soon. So the practices of users and professionals in the internet will probably change in a very few moments. So now we will look at contents. Health contents online. We look at Google, we look at the World Wide Web and also blogs. We analyze 18 general websites about health in Portuguese. And we found out that information there is fundamentally institutional. Formal contents are more frequent, like institutional contents, descriptive, functional, than contents about health and illness. We find sites with health-related information and content, but with no communication process or services with a higher interaction level. Contrary to what happens in Catalonia, where the interactive levels are quite higher compared with the Portuguese experience, but where the presence of institutional websites is lower. We also analyzed 55 health blogs in Portuguese also. They are built from the selection and comment to a given event or news, proceeding from other sources and standing out only a part of this information. General information blogs and diaries prevail. Online practices through blogs are practically non-existent, in spite of the majority of blogs being kept by health professionals, and amongst this, the majority being kept by doctors. The interactivity is very limited. This will not happen. And we also look at healthcare institution and information technologies, trying to understand the organizational changes and autonomy. For that, we have 6 case studies with different information systems and different uses. We made 17 interviews, presential interviews. The institutions in several regions of the country with 6 different stories. We looked at the medicine circuit and the patient computer management, internet and institutional websites, external electronic prescriptions and local health units, telematic health network. This all these things are names of several information systems used in the national health system for administrative and clinical purposes. And we propose a way of looking at this. We use a model where we look at the implementation of technology and what changes with that implementation, if anything changes, and what changes in the organization model, and what kind of impacts these implementations produce, especially in the autonomy of the professionals involved. And there are many variables guiding, in a positive and a negative way, the information systems implementation process, which determinate simultaneously changes in the organization forms of the institutions and in the autonomy process of users and professionals. Some common features we will find, and one of them is obviously the growing use of ICTs applied to health, the tendency into an implementation and need of application in information systems which will optimize care processes given to the community, whether clinical care or administrative quickening. We also found the non-existence of a generalized network concept in the national system, programs and projects disruptions. And doctors are the most resistant group to the use of information and application systems. Now I will present some general conclusions of the study. The analysis of health information systems sends us to 3 analysis units. One is the organization and their management models, of course, the healthcare professionals, the information and software, physical and technological networks, leading us to the need to articulate these 3 analysis units in a way that we have network organizations, more flexible and adaptable to change. And professionals will increasingly value ICTs, leaving the expectation that these values will be more expressive in the future. In a global context where internet is rising as an alternative to more traditional methods of obtaining health information, constant flows of information encourage citizens to be more responsible for their own and their families' health in a context of generalized health information. The use of communication and information technologies is fundamental to the promotion of individual autonomy in the health field. The incentive of internet use in this context depends actively on the type of available contents, the quality and credibility of contents, the ease in using and understanding available content and resources, which gives a central role to the healthcare professionals and healthcare institutions in developing the concept of informed patient or citizen, even because Google is not a doctor. We have more questioning, of course. After finishing the project, the questions remain. In 2005, at Royal Society of Medicine, Professor Andrew Webster was discussing what he called the promise. And he showed us this kind of pyramid where fast accessible information, e-transactions, and telecare change the pyramid in the information age healthcare, where individual self-care is in the top of the pyramid and health professionals as authority in the bottom. And the doubts still remain. And the doubts are, what are the limits of e-health? What is possible to be offered in e-health? What implies e-health, in particular for healthcare professionals? What are the implications of future e-health services offer? New segmentations and new exclusions? I let the doubts for you to discuss after the presentations. Thank you very much.